Hi Farmies, I would like to talk to you about 3 medications that fall into the antiemetics category. So antiemetic means that we give these medications for nausea and vomiting. Alright, so how do these work and what do we need to know about them? So ondansetron works by affecting the chemical serotonin. Serotonin is effective both in the brain, so I'm going to draw the brain here, and in the gut. So here's your gut. So here's your stomach. So we know that a lot of serotonin activity happens here at the stomach level, and then we know that we have a chemoreceptor trigger zone, which triggers vomiting, your vomit center in the brain. So that is, the ondansetron works on both this trigger zone here, trigger zone in the brain, and it works on the stomach by stimulating the gut. So it blocks serotonin receptors in the CTZ, which is the chemo trigger zone, and then it also works, I'm going to show you this one as well. Here's another card for ondansetron. It also works, because we have serotonin in the gut, it's blocking the effects of those receptor sites as well at the vagal nerve terminals and in the chemo trigger zone. So in the gut we have vagal nerve. In the brain we work on the chemo trigger zone. And the neurochemical that we're talking about here is serotonin. Alright, so ondansetron is the main medication that we're going to give our patients who are about to have chemotherapy. So we know for a fact that our patients are going to experience nausea and vomiting with chemotherapy, right? So we're going to give this med, here's like a little clock, 1, 2, 3, 4, 5, 6, we're going to give it 30 minutes to 60 minutes. I'm drawing a clock. There we go. 12, 1, 2, okay. That is supposed to be a clock to help you remember 30 to 60 minutes before chemo. We know they're going to have nausea and vomiting, so we give it ahead of time to try to prevent the triggering of that chemo zone. And then we give it post-op to our patients. So we're going to give it for chemo, prior to chemo, or we'll give it post-op, PRN, for post-op nausea. Alright, so let's see. Let's talk about the next one. Let's talk about prochlorperazine. Also known as compazine. Prochlorperazine works on a different neurochemical. It works on dopamine receptors. Alright, so it alters the effects of dopamine on the central nervous system, and it has some significant anticholinergic effects and alpha-adrenergic blocking activities. So it depresses this chemo zone again, so prochlorperazine also works on that chemo zone, or the chemoreceptor trigger zone, and it works all in the CNS. So the interesting thing about this one is that the side effects for this one all are related to CNS side effects. So we might see neuroleptic malignant syndrome, and we might see extrapyramidal side effects, EPS. So that makes sense because this one is working almost entirely on the central nervous system, so it makes sense the side effects would be related to the CNS. Alright, our final medication for GI antiemetics is going to be metoclopramide. So metoclopramide is a medication that is a gastric stimulant. So it works by promoting gastric emptying. Oh wait, I should be using green. Green is for our metoclopramide. Here's green. Gastric emptying. gastric. All right, so why would we want to get things out of our stomach faster? Makes sense if they're trying to come out this way. So anybody who's having issues with things regurgitating, so things like GERD, aspiration, related to maybe a feeding tube, or if they're just having a lot of pressure building up in the stomach, we would give this related to chemotherapy, surgery, reduction of GERD, prevention of aspiration from enteral feedings. So GERD, aspiration, also the same, chemo and post-op. Anybody who's going to be throwing up could use any of these. And so how does this one work? This one is, again, blocking dopamine receptors in the chemo trigger zone, and it stimulates the motility of the upper GI tract. So we have dopamine again, working on this chemo receptor trigger zone. So all three of these are working on some level on the chemo receptor trigger zone. But this one also has strong effects on the GI to improve motility of the upper GI tract and accelerate gastric emptying. All right, guys, I hope that helps kind of clear up antiemetics and how they work. And have a great day.